Got it. Ah, Ruth, I'm sorry, I cannot listen to you. You're out of sound.
Hi, how are you?
Fine, fine. Today running. Here in La Paz is raining. So I hope we don't have connection disturbances tonight.
Okay, if you have troubles, I will be there waiting for you.
Thank you so much, Belkin.
You're welcome.
Okay. Let's wait 2 minutes more. We have an interesting class, I think. So let me open the presentation. Okay, can you watch my screen?
Yes.
Okay, perfect. Just tell me when you want to start. There's no trouble for me because...
Go ahead, teacher.
Yes, let's go ahead. It's time and we all have the schedule.
Yeah, we are in time.
Yes. Okay, okay, it's in silence. Okay, let's go. Today we are in our 15th class, almost finishing, so.
Oh, it doesn't so sad.
No, that's a cycle that it's finishing, it always happens. So I have to discuss, to treat many points of view tonight. They are not very long. They are interesting, I think. And well, I did my best preparing this material. In that way, we are going to check today the physical examination, giving orders, I mean, a very general view, because we all know how to do it. In that way, it's important for us to remember the vocabulary and the expressions we are going to practice, the mental state examination, the diagnosis and management, the discussing treatment, and giving bad news. Of course, we have to know how to express that idea when something is wrong, and then we might consider the situation. So, studying about the physical examination, we know through the story it's been the first part of the medical job. I mean, it's the basis of our job, of our art, could be said. Because sometimes the patients tell us a history and we know that it's not true because of the findings. And we all know that everything can change and can simply be different. I mean, just evaluating and looking for details that sometimes, if we don't make the physical examination, we might lose. Starting with the neck, according to other cultures, well, through the time is the most important part. And always it must be done. When we take this point, we have to consider that there are important facts to practice, to check. For example, the introducing ourselves. If it's necessary, always saying hello, good morning, good night, good evening, good afternoon, everything. I am, and of course my name, we know it. Then we got with a brief to the patient, brief the patient on what she should expect in a clear and simple way. And here we have some expressions. Sometimes patients go to a medical evaluation without knowing what is going to happen. And of course, we have to take it clear in order to solve doubts before starting, because it could be a very confusing situation if we don't talk about it, okay? For example, do you know what we are going to do this morning? Do you know what is going to happen here? Or I tell my patients, I'm going to examine your, so I can find out what's causing this. Moreover, we can go ahead. What we are going to do today is, that's the way of express that idea. What we do is, what happened is that I will ask you to, and then one of the most important questions, are you ready? Are you okay? Can we start? Asking for the permission, because we have to take care on this specific kind of situations, I mean. And then consider that because of the culture, religion, or something that makes a different situation, patients can feel that they are being maybe abused because we don't ask for permission before touching them, evaluating, making the physical examination, of course. Moreover, we have to instruct the patient in a clear but polite manner. We are going to check some pictures about it ahead. And then we have to show sensitivity to the patient's needs and respond to discomfort, reassuring if appropriate. For example, you might feel a little bit of discomfort. We must alert the patient in order to get a better response, not getting it as an obligation for the patient to realize that everything we do is now for him. And of course, it doesn't happen. We know it. This might be hard a little, but I'll be quick. Usually with children, it's very important to use that kind of phrases. Tell me if it hurts in order to improve our technique maybe, and then avoid a hurting situation. Let me know if it's sore, the same. It will be over very quickly. It won't take long. You are doing very well. So you can see that ways of encourage the patient to show that we are taking care of how he feels on the situation, and that kind of situations that we have to treat, to work on. We must talk the patient through the procedure, telling him, relating, explaining the procedure while we are doing is one of the most important parts, because they feel that you are interested in the well done, in the behavior, in the result, in all of the process, and the patient feels that he is important for you. That's why we use that kind of expressions. I'm just going to, first I'll, then I'll, now I'm going to, you'll feel, when it's over, I'll, that's it, all over. You know, that kind of expression that sometimes in Spanish it's easy to make, but in English we can get confused. But now we have an idea about what we can say about it. Moreover, we have to share our findings with the patient, especially when we attend a bound or we take out an strange body from inside the nose or the ear, or maybe inside the bound. We have to consider this situation, okay? If I don't do this, the patient might say that we didn't do anything, just having fun, and it's not the fact, okay? Well, I'm fairly certain you gotta, and then I have an idea of the diagnosis, okay? One possibility is it could be what we call, and then we give you the diagnosis. I have found anything to suggest any problem. Well, everything's okay, but it's the correct way of expression to say it in that way, because during a process, through this time, you are taking the privacy of the patient. You are invited to evaluate this situation. That's important. That's why we have to check and consider to do this in this way specifically. About giving instructions, of course, we all know that we give orders and patients obeys, and that's all. We explain the patient what to do, and patients have to try to practice on this and work about it. And of course, if they don't do what we say, the result is not going to be the best. We are not waiting for the patient's, I don't know, the patient's moments, maybe just a few minutes if we have enough time to do that. If we don't, I'm sorry, we have with limited time, so we have to work on this. So that's why we start with this kind of instructions, with this kind of questions, with ideas, and then we have to consider that patients don't choose the way of starting. At least you decide is, you have not to lose the control of the situation because you are leading that way. Johan, can you listen to me?
Yes, I can hear you.
Hey, thank you so much. Can you read this slide, please?
Yes. Giving instructions when examining a patient.
Yes, examining.
Examining a patient. I'm sorry. Polite forms are often used for the initial instruction. Could you bend forward as far as you can? If you give me a second.
Yeah, no, go ahead.
Miss, I'm sorry, I cannot continue reading. I'm driving. I'm sorry.
It's not possible for reading. Is that okay?
Yeah, I'm driving.
Ah, you're driving. Okay, don't worry. So I'm going to call you later. I'm going to call someone else, okay?
Thanks.
Okay, John Harold, can you listen to me?
Yes, teacher.
Yes, can you read the slide, please? It's not possible for Johan at this moment.
Okay.
Thank
Given
you so much.
instructions. When examining a patient, polite forms are often used for the initial instruction. Could you bend forward as far as you can? If you could cross your arms in front of your chest. What I would like you to do is examine you standing up. After that, direct instructions may be used. Stand with your feet together, lie perfectly still. To soften an instruction, can you just turn to the side again? Could you just lie on the couch?
So you can see that way of making questions, giving instructions is very important. Thank you, Johan, John Harold. So in that way, you have ideas about starting to do this. Is one of the most important activities we learn during the medical school. That's why we have to remind them and consider that, well, you are the boss in the consultating room. You direct the situation. And if the patient tries to get that way of orders or just doesn't obey you, of course, you cannot work in the correct way. And English is very clear in that aspect, I mean. That's why we have these verbs, these expressions for practicing our vocabulary. And of course, we have to use it because it's going to be with our blue friend. To bend down, to breathe in and breathe out. Close your eyes, open your eyes, of course. Curl up, do this, and they're imitating. Put your head down, put out your tongue, raise your leg, roll on to your back or front, roll over, roll up your sleeve. All of three are synonyms. Sit, sit up, slide your hand down your side so you can see, and we have the picture for giving an idea what we are asking for. Moreover, we have Follow my fingertip with your eyes. Keep your knee straight. Let your wrist go floppy. Lie on your side back. Lie on the bed couch. Lie down. Look straight ahead. Look at something. Slip off your coat. Okay, stand straight, stand up again. Take off your top things. Tilt your head back. You can see the order here. Touch your shoulder with your shin. Okay. And one more, it's a lot of vocabulary, of course. Open your mouth, point to the finger that moves, pull as hard as you can, push as hard as you can. Turn your head to the left, turn on your side, and other instructions. Relax. Show me what movements you can manage. Tell me if it hurts. So with these orders, with these instructions, we got almost of the all way to evaluate the patient. Of course, we know how to auscultate, make palpation, make the percussion. We know all the techniques, the inspection. So that's why we are not considering it at this moment, because we were telling that this course is focused on get vocabulary. And that's why I show you that list of verbs and expressions. Going to the mental state examination, we have to consider that it's very important for us as the doctors to get these concepts clear in English and Spanish, of course, and not get into confusion. Belkin, can you listen to me?
Yes, I'm here.
Yes, please, can you read this slide, please?
Yes, of course.
Thank you.
Some symptoms of psychiatric disorder. A delusion is a firmly held belief which is wrong but not open to argument. For example, a deluded patient might not accept that his psychiatrist is in fact a psychiatrist. Dementia is a significant mental deterioration due to physical change in the brain. Disorientation is a mental confusion about time, place, or identity. Hallucination are apparently normal perceptions which happen without the appropriate stimulus. Any of the sense can be involved, but especially vision and hearing. Illusion. Can you help me with this pronunciation, please, in illusion?
Okay, illusions are misinterpretations.
Mere misinterpretation of real stimuli. Obsessional. Thank you so much. Sorry.
That's okay.
Symptoms are stereotyped ideas or impulses which the patient cannot resist. They include obsessional thoughts and obsessional rituals.
Thank you so much, my dear Belkin. So you can see with all of these symptoms, given the definition, of course, we can get an idea what is going on with our patients. And talking about psychiatric disorders, it's a very, very, very delicate situation, could be said, because ask for that kind of specific information to a relative, sometimes our patients consider it offensive. And they say, how you can think that I'm crazy? Of course, you are not crazy. You have psychiatric disorder and we can treat you. Let's check the correct diagnosis. Or sometimes it happened to me in many situations. Then the patient is carried on to the hospital by the relatives, by parents, for example. And it's like a fight, as if you were into a ring. You have to try to catch the patient with 4 nurses, with many helpers in that situation. And then you are running with your syringe, trying to use sedation. I mean, it's something that is not comfortable to do because it's a person. has many difficult situations that maybe they don't know how to work on them, and it's not easy to get, for example, with patients with hallucinations. It's not easy to try to get in or try to realize what they are living, whether why which ghosts maybe they are fighting, or which ideas are surrounding his mind. And it's not easy to treat something that is out of our reality. For example, people that is with obsessional ideas, we have to consider that they always are moving around this situation, and it's not possible to move a finger without getting a overreacted reaction, maybe overreacted answer response with our movements into the evaluation. That's why psychiatrics are very important for us psychologists. Of course, it's not easy, but we have the idea that we have to check, and if we suspect on any of these situations, the best choice is to ask for help from someone who might be better trained in that way. When we talk about mood, we have to consider that when a patient is describing, well, the mood, it's better for doctors to use the patient's own words rather than their own subjective description of the patient's mood. Usually our patients say, talking about anxiety, they use tense, agitated, restless, anxious, worried, wound up, panicky, frightened. So in that order, our patients express that, and we all know this anxiety. What do we do in our medical report? Patient suffering anxiety, and in parentheses, we can express the exactly words that the patient said, just for understanding how the patient feels the anxiety at the moment. On the other hand, when patient says, I'm unhappy, I'm miserable, I feel low, I feel sad, I'm depressed, I feel dejected, we all know that it's depression. The same way we express this in the medical report. Patient suffering major depression, for example, and in parentheses, the expression that patient said. That's the only part on the clinical story, the medical report, when we can express the idea of the patient in order to understand how he is understanding the situation, how he is receiving the answer from the environment. Okay, it's important. Of course, patients may also use the following adjectives, and they describe the condition like this. Catherine, can you listen to me?
Yes, teacher.
Yes, thank you. Can you read this slide, please?
Okay. I get very confused about time. I cannot remember what day it is. People make me hungry. They are so irritated.
Okay, irritating.
I'm too embarrassed by embarrassed. Thank you. By my appearance to go out, I stay at home. I get moody when I go out for meal and I come back with cheesy.
Okay, thank you so much. So you can see these expressions: very confused, angry, embarrassed, mad. So they are looking for how to express how they really feel. And of course, it goes to the hand to the diagnosis with these definitions, right? We have to consider that it's not easy for anyone to talk about how mentally the mental health is going ahead. It's not easy to open ideas, to open our heart and express how I really feel, and say how embarrassed I feel about myself, how depressed I am, how difficult it is for me to go out. It's not easy. It's not a fact, and it's not that you say, oh, you should go to take a therapy and go ahead. No, it's not that piece of cake. We should be in that way. And an important tool we can use in our consulting rooms, maybe sometimes in emergency rooms with kids that are having trouble about expressing how they feel, or with people that is very scared about talking with us. We use the mood meter, and they can see how they feel and how energy they are losing and how energy they are feeling moving inside. You express it that way. You feel something is moving in your body, and then you feel something that maybe you cannot understand. If you feel too much energy, and then you have this strange feeling that tries to make you cry, for example, to make you move, you can choose one of these situations. You feel negative in a negative way, you are in bad mood, but you feel lots of energy, you can consider these situations. And just the patient's point and choose which one is feeling at this moment, and it's very useful. I use it with children many times, with kids, and it's important. They understand the idea and they choose the situation, and they can talk about it easily than trying to get a definition of what they feel, because sometimes they don't know what's going on. It usually happens with adults, with people that it's not receiving that kind of support. That's just for information. I think it's important. Well, moreover, we have typical questions for a mental state examination, right? Questions that always are done, are always made, and we don't realize them until we got them into a list, right? Ruth, can you listen to me?
Yes,
Yes, thank you. Can you read this slide, please?
yes. And typical questions from a mental state examination. Can you describe your mood at the moment? How long have you been feeling like this? Do you take pleasure in anything? How are your energy levels? What's your appetite like? Have you noticed any change in your weight? How are you sleeping? Can you keep your mind on things? What do you feel the future holds for you? Have you ever felt that you don't want to go on? Have you ever thought of suicide?
Okay. Have you ever thought of suicide? It's a very important way of, yeah, suicide.
Okay.
Okay, thank you so much, Ruth. So you can see these questions are very direct, and patients usually close about answering it and say, no, of course not, or no, everything's okay, and try to change the point of view and change the answer. But of course, the attitude is going to show you what is going on. It depends how you break the ice at the moment of the beginning and how the rapport is being done. But you have the ideas that when we make these questions, we have to be in a separated space, far away from the rest of the patients, maybe in a private room, and then we can talk easily in that way. And considering the answers, we can direct the situation and then help our patient. Well, we have another important topic, explaining diagnosis and management. And we have specific instructions to give at this moment. For example, when we give explanations about diagnosis, we have to consider that it's not just to get the disease, right, the situation, and it's for us. No, it's not the way. We have to talk to the patient and tell them what's the problem. And he's going to be relaxed, he's going to be confident with you, and it's easy to make. And the best expressions, I think, the best way of doing this are shown in the slide. Of course, the same occurs with the management plan. We usually decide by our own, but it's better if you get a chance the patient to explain his point of view and then get in accordance what is the necessity of everything. And they, of course, are very, very, very nice because they do everything considering that you are right. They don't feel obligated. They feel they know that it's for their well-being, and it's easy to make. Johan, can you listen to me now? Is that okay? Johan.
I'm still driving, miss. I'm sorry, I apologize.
Okay, please let me know when you finish driving, please. I'm taking in count
Okay,
the
thank you.
assistance and the participation, okay?
Okay.
Okay, for example, with the diagnosis, of course, we know is the identification of the disease from the signs and symptoms. And we can start explaining this with these expressions. You are suffering from, you've developed, this is why, you have, this is because, this is mainly because. Starting with these specific ways of expression, it's easy to the patient to be receptive and understand that you are doing your best. About the management plan, including investigations and treatment, of course, you can start in this way. I will make an appointment with, considering to refer the patient to another specialist or to another doctor. I'm going to start you on medication too, of course, treatment. I'm going to have you admitted to, you are referring the patient to another service in order to get evaluations maybe. I'll arrange for you to, so you consider the situation and another point of view. You'll be given again treatment. They, my advice, I expect you'll have. So you see, this way of talking is a very important, I think. Moreover, we have to consider the general advice about any change in lifestyle that may be needed. For example, give you smoking, drinking less alcohol, but we have to consider that if we don't give the correct expression, we can offend the patient and it's going to be a big problem for us. That's why we can say the nurse will give you an advice on, because nurses are prepared for explaining these changes in lifestyle. They know how to do it sometimes better than us, and they have better ideas, better ways of expressions. And of course, they help us to doing this. On the other hand, we can do it by our own, and we can say, you should try to give up and then change then the situation. I want you to, it's important that you, so consider these situations in order to give an advice. It's not an obligation of the patient. About the prognosis, we can say, well, what is likely to happen because of a disease, stressing that nothing is certain. The prognosis, we know it could be non-positive, it could be the best, it depends on the situation. We can start explaining this using these expressions. I expect the treatment will, hopefully we can never be absolutely certain about. You should remain optimistic. This one is very important when you talk about chronic treatments or maybe oncological treatments, right? Questions time, where the patient can ask you, make as much questions as they want about the situation. Could be illness, could be a specific situation. It depends on the context you're talking. And we open that door of asking questions, telling the patient, do you have any questions? Is there anything you'd like to ask? It's important because if patients don't receive the answers about the complaints at the moment of the information is receiving, nothing is going to work ahead. I tell you by experience, you have to get a relaxed patient with all the new information and the new situation they are living, they are their suffering. That's why we have lay terms in explanation that are very useful. Explanations should be given in words that the patient will understand, avoiding the medical jargon. So never forget this, because not all of the people is obligated to understand our language. Yeah. Medical English is not easy. Medicine in the Spanish is not a piece of cake. We know this. Even for translating is difficult. Using lay terms, words familiar to people without medical knowledge, can help patients to understand the explanation. That's easy, but it's easy when you get practice. Not at the first moment you're going to be the best one doing this. So we have some situations that we also use during the medical job, I mean. The medical condition, for example, with the acute cerebrovascular event, can be translated into a lay term as a stroke. All the patients know what the stroke means, so it's easy for us. An arrhythmia, patients refer to as palpitations. Dyspnea, breathlessness, of course, we were studying and checking it in the module 1. Fractured neck of the femur, broken hip, of course, easy to make, easy to understand, a piece of cake of the patient. He is not obligated to know that the neck of the femur usually get broken, right? Hematemesis, vomiting blood, of course. Hematuria, blood in the urine, of course. They don't have an obligation to learn this. Insomnia, trouble with sleeping, yes. Intermittent claudication, pains in the back of the legs when walking, myocardial infarction, a heart attack. We use a lot this lay term. It's for legos, for not doctors, but in English, with our colleagues, we have to use this kind of vocabulary, of course. The nocturia, needing to pass urine, to pass water at night. We know this. We were practicing these expressions during the model 1, as I was telling you. And we all know during our reality way of working, how it happens. About medication, about that kind of situations. Analgesics, of course, are painkillers. They all know about it. Antidepressants are tablets to improve your mood. That's the way they say. I'm taking pills to improve my mood. Oh, they're antidepressants. Anti-inflammatories, medicine to reduce swelling. Common and used to express, to understand. Bronchodilator, a substance which causes the airways to open up. When we have asthmatic patients and you ask for them what they are taking, they said, I'm using this, that's all. And you have to understand the movement because of they are inhalating the medication. The DMARDs, disease-modifying anti-rheumatic drugs, okay? The DMARDs, pills that help stop arthritis progressing. So this is very important because nobody knows, even colleagues, this expression. But now you got the idea, you got the topic. The diuretics are the water tablets. Usually elderly people tell you this expression. Hypertension medications, pills for blood pressure. We use this expression a lot. Hypnotics, sleeping tablets, of course. Oral contraceptives, the pill, very common expression, right? Sorry. About definitions, the simple definitions. Belkin, are you there? Can you listen to me?
Yes, I'm here.
Yes, can you read this slide, please?
Okay. Simple definition. Most patients do not have a medical knowledge, so it is important to use simple words. They will understand when talking about certain parts of the body or medical conditions. We have a chart here. It's talking about medical term, simple definition, arteries, tubes which carry blood around the body, benign, not due to cancer or infection, bronchi, airways that connect your windpipe to your lungs, cholesterol, fat that clogs the arteries, invertebral disc, shock absorbers which separate the bones in your back, esophagus, the tube that connects the back of the throat to the stomach, pancreas, a gland that helps digestion and makes insulin to control blood sugar, thyroid, a gland that produces some of the hormones required in daily life, urethra, the tube that carries urine from the bladder.
Thank you so much, Belkin. So you can see with the medical term, the anatomical reference, the simple definition is helping us to express that anatomical reference for patients that are out of in medicine, out without any knowledge. It usually happens with elderly people, with kids, and of course with poor people that doesn't get the opportunity of studying. It usually happens, it's very common in our countries. So you have to consider this. Okay, and there's more vocabulary to check. I mean, more than vocabulary, maybe it's the way of expression we can use about it. Get the idea. Well, here we have a very long explanation of angina, considering that the doctor is with the patient. Maybe a volunteer for reading. Anyone who would like to do this?
I can try it.
Okay, go ahead, Ruth. Thank you so much.
An explanation of angina. Having examined you, I am confident that you are suffering from angina. The heart is pumped. The more do you physically, the harder it has to work. But as we get older, the blood vessels which blood vessels which supplies oxygen to the heart begin to harden and get further up, so they become narrower. They can supply all the oxygen the heart needs. The result of the pain you feel as angina, because you are experiencing pain at rest as well as an exertions. I am going to have you admit to the coronary care unit right away so that your treatment can start at once. You will be given drugs to ease the pain, and I expect you will have an angiogram. They may advise surgery or angioplasty, that's a way of opening up the blood vessels to the heart so they can provide more oxygen. You should try to give up smoking. You won't be able to smoke at all in hospital, so good time to stop. I expect the treatment will improve your pain and list and may get rid of it completely. We can never be obviously certain about the future, but you should remain optimist. Do you have any question?
Thank you so much, my dear Rose. So you could see in all of this explanation, we are using all the expressions we are checking through this time. Okay, from the first one, except of the introducing yourself, all of the explanations are here, all of the expressions are here. That's a good example for practicing, for trying to do by your own, and then, well, consider that it's important. And if you receive this kind of explanation, that open ideas, and you got the opportunity about asking or saying something that is important for you, well, you feel. Moreover, going ahead, we have to discuss the treatment, and we have to offer options. So offer option is very important, because when we discuss the options with the patient, we have expressions as a doctors that we can use, that we can consider. And we can be very close about it, not with more than one idea. But on the other hand, we can be wide and let the patient choose, and that's all. There are around a couple of options we can use. The first option is to try tablets like Prozac that lift you up a bit. The other option is counseling. So you can see the difference, okay? Another way to explain this, it can be caused by diet or stress. There are some quite simple tests we can do. If you are still concerned, we can refer you to a hospital. So you get the topic idea, you get the situation with the patient, and you get in accordance to start working with this. And of course, patients feel better. About advising a course of action, we have more expressions that we as doctors can use. John Harold, can you listen to me?
Yes, teacher.
Yes, can you read this slide, please?
Advising a course of action. When advising a course of action, doctors may say, some time off work might help. If you feel that it will be helpful, you could take a week off and see how you feel after that. If you still have some pain, you can keep taking paracetamol. Other things might help, like raising the head of your bed. That's one of the simple things we could start you off with. You said you haven't tried indigestion remedies. That's something you could try. Carry on drinking lots of fluids.
Thank you so much, John Harold. So you can see we have lots of phrasal verbs, we have instructions, we have expressions that, of course, we use daily during job, during our normal activity, and we know how to express them. But in English, as I was telling you in the last presentation, the one on Monday, we have to consider the phrasal verbs to make it in a polite and elegant way. For example, the carry on, keep taking. However, you could take off, for example, and it's important. It's important to check, to review, and to practice. About advising patients to avoid something, of course, we have to be clear, we have to go with careful, sometimes feel offensive about it, but it's not the objective, of course, for us. It's just help and correct the situation. Catherine, can you listen to me? Catherine?
Yes, teacher.
Can you read this slide, please? The bubbles.
When advising patient about something, doctor maybe say, there are a few things about your lifestyle we could address, perhaps cut down on the amount you're drinking. Giving up smoking will help. Cut out fatty foods.
Yes, fatty foods.
You should try to avoid tie clothing sitting in deep
Armchairs.
Meeting, especially after meals.
Thank you so much. So you can see more phrasal verbs. Cut down, giving up, cut out. Try, well, this is a compound phrase you should try to avoid. So you can consider that way of expressions, okay? Advising, it's not easy. Not all the people like to listen to an advice that it's not asking for, but it's our duty to do this. We made it daily, yeah. About warnings, we have more expressions to take in count. For example, when we want to warn a patient of the consequence of ignoring the advice, and that consequence could be serious, we can say, if you are not feeling better in 7 to 14 days, you really must come and see me again. So you see how strange it sounds. You really must come. It's your obligation to come again. It's like that. It sounds like this. Another one. If you feel that things aren't settling, aren't getting back to normal, it's important that you see him again. That's the same with easier words. I feel that they are so cute, and maybe patients, they don't take so much importance, but it's because of a reason we are taking the time about talking with this. Another one. If you keep damaging it, you are going to end up with a long-term trouble, with a long-term problem. So we consider the situations during the time, considering the future, of course. So the patients take an alert. Another one, it's very important you don't stop taking the tablet suddenly, or your symptoms will return. So telling them the consequences about avoiding treatment, leaving treatment, not continuing this, they easily get an alert and continue taking pills, and that's an interesting way of working. About bad news, we must consider that it's not easy to go to your patient and tell something that it's not good. You have to be more than sure that that bad news is the truth. I mean, is the one you are, well, that you don't have any reason to change it or to try to make up it, to change the meaning. And you have to consider that it's better if you follow the principles of this procedure, because it's a procedure to explain about new. First of all, you have to give warning. I mean, you can say in that way, I'm afraid your test results aren't very good. I'm afraid, I'm worried about you, and feel the empathy on this situation, okay? Another expression, I'm sorry to have to tell you that the news isn't good. Again, empathy in that situation. When you give a bad news about a chronic diagnosis, a no good situation of this, well, you have to try to be in the position of the patient, in the chair he sit, and receiving that news is not easy. Moreover, you have to choose an appropriate setting and have a friend or relative of the patient present. If the patient is alone because of the shock of the news, it's seen that many of them decide to suicide, decide to that there is no reason for going ahead, there is no way of understanding why it's happening to me, and they said, okay, that's all, I don't want to continue, and that's over, and they commit suicide. It's usually, very common. I mean, when you talk about AIDS, when you talk about cancer, at the beginning of the pandemic, it's talking about the COVID-19, because we didn't know all the consequences. We still don't know the complete impact we are suffering at this moment. So being appropriated and getting the support of a family or a relative is very important. And we have someone that could testify all the things we were telling to the patient. We, of course, have to take enough time to do this. We don't choose the emergency room to give a bad news like this one. We choose a comfortable place, maybe the consulting room, but with more time to talk about it. And we have to use the appropriate language. As we were watching in the last slides, we had a complete way of expressions about how to do it. And the appropriate language is important. If you go with the medical vocabulary and that kind of expressions, and the patient doesn't understand you, he's not going to realize the situation, and if he's not going to take into account all the advices. For example, well, moreover, you have to emphasize the positive. And we say, how I can emphasize the positive in a situation like this? And it's easy. You can say, there is a lot we can do to help you. Okay. You are emphasizing the positive. You are trying to be in the patient's shoes. Yeah, you're being empathy. And it's important. Chemotherapy will make you more comfortable, and that's true. It's going to avoid pain. It's going to make you feel maybe upset 1-2 days, but then you can feel better if you continue the treatment. Moreover, about discussing the prognosis, we consider these expressions. One can never be certain about the last things, but I'd say it's a matter of months rather than years. Yeah, you can see. If you don't talk about this time of treatment, of consequences, you're going to lose the confidence of you with your patients. Another one, supplement the verbal message. Well, as an example, I'd like to record these consultations so you can listen again if anything isn't clear. Sometimes it's important for the patient to record all the interview, all the medical explanation, and then listen again, and then get the idea, and they say, okay, now I understand. I can go and ask as much questions as I can. Moreover, we have to arrange a follow-up session, and we say, I'd like to see you again next week. Can you come in again in next week? For example, these examples of the phrasal verbs, how we use this. So in that way, giving that close treatment, it's not as complicated as it looks, but it takes time. We have to consider this. Confirm that the patient understands. Could you tell me what we are going to do for you? And it's easy for the patient to tell about it because he's remembering all we were talking from the beginning. He's remembering all the situation, and then he's more helpful with us. Or maybe is everything clear to you? They can say yes or no, and then we have to take again enough time to explain the patient the situation. Agar, can you listen to me? Agar.
Teacher?
Yes, can you listen to me, my dear? Agar. Well, there's no trouble. Maybe a volunteer for reading this.
Teacher, can you hear me?
Yes. Yes. Well, who was talking? Yeah. Agar?
I can read it, but I don't have a good connection right now, teacher.
Okay, let's try to do it, okay? Try to go ahead as much as you can, and then if the audio loses, I understand the situation, and I'm going to go ahead.
A consultant medical oncologist report Dr. Harry Scott diagnosis previous pancreatic cancer. I review Mr. Scott in the oncology clinic today. He has been less well and has lost 12 kilograms in the past few months. Unfortunately, his CT scan show an area of ill-defined low attenuation in the tail of the pancreas. Although this is a consistent with focal pancreatitis, the general feeling at the multidisciplinary team meeting
Okay.
I can see your meeting. I'm sorry.
Where are you? Can you watch my screen? Maybe connection
Yes,
disturbances?
yes, and now I can see. The meeting was that this represent recurrency. This is especially likely in view of his clinical deterioration and raising C8 99.
19.9.
99. I discussed this with Mr. Scott and his wife. He was obviously disappointed with the scan results, but still tries to remain positive. We discussed the fact that the surgery wasn't an option and symptom control was important. No, yes, was important. We also discussed the role of palliative gemcitabine,
Yes, gemcitabine.
the benefits are small, but it is usually well tolerated. And he has with this. I will to start treatment in the
Ahí. Good. Well, okay, I'm going to go ahead, okay?
Hello.
Hello.
I don't know if I can read.
Yes, go ahead, Johan. Perfect.
Okay.
Just help Edgar because here is raining and disturbances in connection are awful. Go ahead, please, from the point she was over.
Okay, Mr. Harry, a consultant medical oncologist report.
No, we
Mr.
are going
Harry
to start. Johan, give me a minute, please. We are going to continue from the Genta gemcitabine. Can you watch my pointer?
Okay, yeah, I got it.
Yes. From this point to the end, please.
Okay. The potential benefits are small, but it is usually well tolerated, and he was keen to proceed with this. I will therefore book him into Ward 2 to start treatment in the next few weeks and have rechecked his blood today. In the meantime, I would be very grateful if you would refer him to your dietitian. He himself is keen for this to happen. We will see him back in clinic once his treatment has started.
Thank you so much, Johan. Thank you, Agar, too. I know there is not easy when we have that kind of disturbances. Well, here we have this report in order to get vocabulary and more expressions. And we have this a way when we said the surgery was not an option, wasn't an option. We have to be clear. When something cannot be done, it's not possible, there's no way. And we cannot renegotiate with the patient. They don't take the final decision. We do this. That's why it's important to know and to consider this way of expressions. For example, this verb to book him into Ward 2, it's important because we book our patients with the most important, I don't know, colleagues we are considering for practicing and start treatment, start procedures, things that, of course, we are not going to solve by our own. And referring patients is, of course, one of the best situations. The correct attitude is feeling keen for. To keen for is to be comfortable, to be in confidence with the treatment, and that's why it's important. So with this kind of expressions, I think we are almost ready for finishing the course. And never forget, don't stop when you are tired, stop when you are done. You can do more. You are doing your best to go ahead. it's a lot of information that we are receiving at this moment. I know there are a lot of expressions, a lot of vocabulary, but it's important to check again and review and practice. And well, read and read again. So maybe a question you got at this moment, something you would like to comment, maybe to tell. If there is no questions, no comments, we can fill the pool and go home, yeah, and go for studying.
Yes, thank you.
Okay, as a
Thank
custom,
you.
I'm going to send
Bye-bye.
the slides in a few minutes, please. And that's all. And see you tomorrow in the workshop. Okay, so see you tomorrow, everybody.
Bye. See you
Bye.
tomorrow.
Bye.
Miss.
Ruth, give me a second, please.
Oh, yes.
Yes, yesterday we were talking about staying a few minutes. Is that okay for you, or do you prefer to go and rest?
No, it's okay. We can take a minute.
Okay, yesterday, well, you were telling me that you didn't have enough time to check the slides, I mean, and to complete the job. From
Yes,
yesterday, did you have the chance of checking something?
I have a yes, I have the meet. I work about 2 pages
Okay,
about the homework.
let me, from homework?
Yes.
Okay, homework, send me as soon as you can. I didn't evaluate I didn't check, yes, I didn't check the homework for me early of the class because my kids are sick, so I've been out of time. It's not easy at this moment, but I think until Sunday I'm going to finish it and of course send the key of the homework. But maybe if there's a question, maybe we can solve it. Did you have time to check the slides from yesterday? When we're talking
No,
about
I don't check that. I tried today, but I have a lot of work.
Yes,
so I can read in the presentation.
Yeah, we have lots of vocabulary there. So watching and considering this, it's not easy. In that way, how can we do this? Try to check them. And if you have any question, please let me know by WhatsApp. Okay.
Okay, thank you. Yes.
Okay, I own you the Wednesday class from the last week, right? You were asking for about it. I'm going to send you, okay, in a few minutes. Let me open.
Yes, the Wednesday, the
class.
last week.
Okay, I'm going to send
Yes,
you
that is
Wednesday.
the only one that I can download.
Okay, I'm going to send you by your personal WhatsApp the slides, and now to the group the rest of the information, okay?
Okay.
Okay, so I think that's all.
Okay, thank you so much.
Okay, so
yes.
see you tomorrow. Try to read, and if you have any question from any presentation, please let me know, okay? Okay. I just received a message from a girl. And well, too much problems with connections. Try to get into your assistance. Okay, I hope she can get into job. No result. The class is over. I'm going to wait for a few minutes. And of course, I'm going to justify this situation. 5 minutes. And let's make the assistance today. Let's try to do this. I didn't check this. Big mistake. Well, I'm sure it's not easy for my students to consider this. But it's not my fact if they don't consider this as important as it really is. It's not my business, yes. So I'm going to send them the presentation. And that's all. Simple definitions. Sometimes it's not as easy as we consider it, and it's not easy. While I'm preparing the assistance, we can expect from Agar. I hope she can get in. It's not easy for her. And here, banking. Root. Yes, 6. Just 6. What does that's 4, 6? Yes, just 6. The rest is out. And it's none of my choice. What happened? Again. Okay. I know Ariane is at the university. And Fabiola is working. Encuentra clases de la universidad. Okay, one more. What is about? Yes. Ontario. Okay. Okay. Hi, Agar.
Teacher, good night.
Good night. Don't worry, I understand the
Sorry, my
situation.
connection.
I think it's awful, right? Can you watch the
Yes,
diary
because
pool?
it's raining here. I feel it, the pool right now.
Perfect. Now your assistance is without trouble. It's important. Assistance is going to be an important part of the score. Well, I try to help you as much as I can.
Thank you very much, teacher. So see you tomorrow at the
Okay, see you
workshop.
tomorrow. Please check the vocabulary. It's a lot of information, a lot of vocabulary. When I read it, I almost fall down.
Okay, teacher. Thank you.
Okay, bye. See you tomorrow.
Bye,
Bye.
teacher. Bye, bye.